RSV cases are still on the rise, and now parents and doctors are keeping a close eye on infections, especially as some medications become harder to get. Thank you for watching. I'm Rolly Hoyt.
And I'm Faith Woodard. Tonight, THV 11's Jalissa Garza shows us what hospitals and health experts are doing to battle the ongoing surge and what parents should remember when fighting RSV and other illnesses.
There's honestly probably a good 8 to 10 different viruses that are roaming around right now that we're seeing kids pop positive for.
Pediatrician Josh Lyon says the virus they're seeing the most right now is RSV.
There are days we're seeing 30, 35 kids a day with a good half to 3/4 of those being something like flu RSV.
The Arkansas Children's Hospital experienced a spike in RSV cases during the late summer and early fall for the second year in a row.
We may have kind of hit the peak of RSV, but we're seeing a lot of kids with respiratory syncytial virus infection.
And Dr. Rick Barr with the hospital says there's a chance for another potential spike later down the line.
We're preparing for that. Certainly that we could have a second spike in RSV at the normal time, which is usually January, February.
Dr. Lyon also keeping a close eye and staying prepared, especially with certain medication harder to get a hold of.
And we treat those very routinely with amoxicillin. And amoxicillin is certainly in short supply.
While ACH tells us it's not experiencing that shortage right now, Dr. Lyon says there are other options that can help patients.
There's always a second route and a third route and a fourth route for us, and we're not working all the way down those lines yet.
And with holiday gatherings around the corner, both doctors say the smallest things can make a big difference.
Good hand hygiene for families, setting the expectation around maybe no kissing on the baby this Thanksgiving.
Jalissa Garza, THV 11 News.
And when it comes to preparing for what we could see in February, Dr. Barr says they are keeping a close eye on Australia. He says the country had an RSV spike in the middle of their winter.